Well, good morning, everyone. Thanks for joining us today. We have some exciting information to review with you. I'm Kay Vandervaart. On behalf of the Employers Healthcare Alliance, we're really pleased to welcome you to today's webinar featuring MedWell, or Mediterranean Wellness. Y'all have heard of the Mediterranean diet, I'm sure. So this takes that one step further. For those that are new to the Employers Healthcare Alliance, I just want to share a little history background. It was created to bring employers practical, credible, innovative solutions that really address the rising cost of healthcare while improving access, engagement, and outcomes for employees. In essence, it's to make your life as an HR director or HR professional a little bit easier. So our focus is on education, collaboration, and bringing these ideas to you, which is what we're doing today with MedWell. Let me just share a little bit of information here. Share the screen. And MedWell is really all about the Mediterranean wellness, how Mediterranean or folks in the Mediterranean live, and how they live better than what we do, right? So today we have Will Clower, who is the founder and CEO of MedWell, to give us some idea of today's solutions that from MedWell's platform and their eye, how they can address some of the most challenging, the most difficult challenges for HR professionals. So our goal today is to provide the overview of MedWell and how that might fit in with your employees. If you're a small, mid-sized employer, this is perfect. I know in working with Will and Mediterranean Wellness, they take on the heavy lifting. So just to set the stage, we'll be talking about the employer challenges and healthcare costs. We'll take a little dive into the MedWell platform and actually, kick the wheels a little bit and take it for a test drive. And then we'll talk about predictive analytics and some of the other things that MedWell does so well, that their award-winning platform, it's obvious. So without further ado, let me introduce Will Clower, the CEO and founder of MedWell. Will, welcome to the webinar.
Thank you. Thank you. It's great to be here. I'm very grateful for you guys having me on and having the opportunity to talk about who we are and what we do. So just a little quick background so you know who's talking at you for the next half hour. I am a neuroscientist by training, because all of this sort of pertains to the products that we've created. I got my doctorate from Emory in Atlanta about 100 years ago, and I immediately got a position to do primary research at the Institute of Cognitive Sciences in Lyon, France. While there, I saw what everybody else sees, these people, right? They're thinner, they're healthier, and they get to eat the cheese. As a behavioral neuroscientist, what interested me most was the behaviors. What are they doing to get those results? So I guess because I don't have enough to do in my day, I just wrote it all down as a cultural comparison of lifestyles. That became a book. And when we came home, got recruited back to Syracuse at the VA there, I had employers, because of the visibility of the work, reach out to me and say, can I apply this for our employees? Are you kidding? Dude, I'm an academic. Design a curriculum to motivate and educate people on a topic I'm passionate about all day long. So suddenly, I was in front of a few thousand people coaching them on the principles of Mediterranean wellness. And honestly, there was a moment when I felt like I was probably doing more good on this planet doing this than recording brain cells from awake behaving primates. So I leapt, a leap of faith, stepping off the academic cliff into this sort of entrepreneurial void. I founded Mediterranean Wellness. That was in 2003. And now we've created an entire health technology platform. We currently serve about 150 clients, over 300,000 lives. And so everything, all of this is to say that all the things we coach and provide is all based on the principles of a Mediterranean lifestyle as seen through the perspective of behavioral neuroscience. One more thing for my background. From a business perspective, we have thrived over these 20 plus years and never had to raise capital for our company. And the reason why is, I believe, is that our DNA as an organization is to take care of our clients, take care of our partners. Our goal is to be the best Swiss Army knife you never knew you needed. And it's not just that's not just what we do, it's who we are. Anyway, that's my background,
It's
Kay.
not just what you say. I've been working with Will and his company now for about 3 or 4 years. It's not
Mm-hmm.
just what Will is saying. He truly believes it. And we have him in some fairly large clients. And what I love about what you said about not taking any investment and what's in your DNA about really just caring for people and helping them move things forward is you not only just say it, you do it. But that's also what makes it so intriguing to the clients that we work together on is you're flexible. And it's like one of our very large clients, I'm trying to move them towards AI, and Will's like, yeah, I can write that. He's a neuroscientist, so I'll leave it at that. So, some of the organizations today, when we talk about wellness and wellness initiatives over the years, we all face some of the same challenges. It might be too generic. A wellness program, what's the ROI on a wellness program? Maybe it's too generic, or employees don't know where to start and there's not a lot of guidance. Hey, here's a portal, go on the portal and do this. And I think that's where Mediterranean wellness is different. So that's where we're going to talk today about where Mediterranean wellness, or MedWell, is designed to help folks come over that barrier. So let's get right into it. Let's hear more about MedWell's unique services and their award-winning platform. So, Will, how does Mediterranean wellness differ from other wellness programs and portals? I think that's the
And
big question.
traditional ones. Yeah. I mean, look, I'm a scientist. So for me, it's all about the data and using that to create an intelligent system that can actually improve healthy behaviors. So for our platform, first of all, as you alluded to, we bring the most accurate predictive analytics system, those data that shows you exactly not only what your current health pattern looks like, but also what it's going to look like 12 months into the future. The accuracy of these predictions, 97 to 99%. So think about this. What does that do for you? This allows you to see around corners so you can head off high cost conditions before they arrive. That means you get to miss the pothole before it takes out your tire. Also, zero, like what makes this different? What makes this unique? Zero other platforms deliver the principles of Mediterranean wellness for corporations and broker groups. By now, like you said, okay, everybody's heard of the everybody's heard of the Mediterranean diet because every single year it's the healthiest diet on earth. But the question is, how do you do what they're doing? Get their results, but do that on our side of the Atlantic. That's where the principles come in, because principles apply across condition to grocery stores, to our crazy busy lives, to the basic realities of us living here every day. We deliver those Mediterranean diet principles at every level: nutrition, activity, mindfulness, weight management. And we get all that to members through delivery vehicles like interactive challenges, programs, webinars, mindful meditations. So, and so I hear this and I know that it's a lot. I know that. So I want to frame it in a way that gives us a handle we can hold on to and think about it. Um, the way to think about it and how it works is like a process called predictive intervention. A predictive intervention process is how you leverage that predictive analytics data, meld it with behavioral data, and use those two together to drive the healthiest approach on earth, and use that to get the exact right program to the right person at the right time. I
Well, let's
mean,
take the predictive analytics, because we talk about predictive analytics and reporting and how HR professionals and employers can read that and look into the future, kind of look through the windshield instead of the rear view mirror. But take that one step further for the employee experience. For example, all of the data that you get through claims analysis, biometrics, all that data that you're ingesting, what does that mean, Will? What does that mean to me as an employee? How are you going to apply that structured approach to get me to do something? What's the employee experience?
Right. So here's the behavioral truth from the neuroscience side. Internal motivations for action are crazy diverse. It's all over the map. To manage that level of diversity and get, as we said, the right program to the right person at the right time, we apply these two elements, our HRA, and then we overlay that with the data that we get through predictive analytics, including a motivation index, which is, by the way, a validated quantitative index that shows personal motivation levels. It's not a gut read from some subjective interview. So I want you to stop for a second and I want you to think about what that combination gives groups. The HRA gives you insights on behaviors, and the motivation index shows you exactly who's ready to go on which one of those behaviors. Amazing. So you asked me, what is it like for people on it? What's the user experience? After taking the HRA, our algorithms layer in the claims data as well as the behavioral data. So the second you complete it, you're given a set of programs that are what you just told us you needed. Working on that sweet tooth, here's a challenge. Here's a webinar for that. Here's a program for that. Not doing enough strength training, but ready to try. Here's a program for weight training without a gym. Need to eat healthier? Here's our core program, or a grocery store tour, all delivered with those principles. Then the program for you is placed back on your dashboard along with an incentive management system. And to your point about a personalized experience that's relevant and encouraging, we include a communications system to the employees, not just blind reminders. This is where that AI communications portion comes in, because it learns person by person the best way to engage. And Kay, it's me, right? So I made sure that this learning mechanism baked in a closed loop conditional reinforcement system with A/B testing, reinforcement learning, conversational mirroring that checks on the communications tone, its format, when the person engages, how they engage, so that, like your brain, if there's a particular thing that you respond to, it reinforces that pattern so that the experience doesn't just seem like personalized on day one. It gets better with every interaction.
Well, something you just said, and let me just remind everybody that's listening today live, if you raise your hand with a question, we'll call on you right away. This is an interactive webinar. It is recorded. We will be posting it, but just want to make sure that you have that availability as well. So something you just said, Will, is, hey, we gauge the motivational change. We take the data from several sources. And if somebody has a HRA that they're using, you can ingest that too, right? It doesn't have to be MedWell's HRA. So you take that data and you develop a personalized strategy or plan, a health journey. What if I don't want to make a change right now? Are you going to send me all of these push notifications and, hey, you have diabetes, we need you to do X, Y, Z. And I mean, it's going to be like a sales approach that I just start blocking calls or blocking emails. Explain to us how that diversity and where people are is also a fit for what you do with your communications and outreach.
Right. With the communications and outreach, you can get it via email or SMS, both or neither, and you select. You get to choose that. If you want to have if you want to have reminders, you can have them. If you want to have less reminders, you can choose that. It's very customizable to the level of the individual. So regardless of your health journey and the stage of your health journey, you can customize that yourself. So we've built the system to be that flexible. Does that make sense?
It does. Well, let's maybe kick the tires a little bit. Are you ready to do just a little overview of some of the components of MedWell, like the lifestyle, nutrition, Mediterranean wellness, some of the challenges that you have? And it looks like Bob has a question. So while you're getting that up and running, we'll take Bob's question.
Yeah. I thought I'd ask before Will got going into the details, but Will, a number of our members, people that we're talking to, they're not big. They're small to mid-size employers. Um, and I guess I know your answer is going to be yes, but I guess the question is, how small is too small to make an impact for what you offer? I mean, does it make sense for an employer to invest in, you know, MedWell and wellness if you've got 50 or 75 employees or 150? We know it does for 1,000 plus, but what about that small to mid-size employer and their work families?
Well, of course, the answer is yes, but the reason why is important. Um, the impact that we make is at the level of the individual, and of course, we roll that up into the level of the population or the level of the site population or the regional populations, depending on the size of the group. But the principle is the same for the small groups too, Bob. So if you have 50 lives, if you have 150 lives, that's just fine from the perspective of getting engagement and reaching out to them. And even with our, just to return to that, our AI messaging, the learning is at the person level. And so the customization is at that level. And so when you get when we get the behavioral data from the HRA, and then we get the claims data or the clinical data, whatever it is, and we fold those together, we knit them together. When you log on, you get your own program. Everyone gets their own pattern based on them. And that doesn't matter if you're working for Toyota or you're working for John's Foods down the road. It doesn't matter. It's individualized to that specificity.
And it's on a model of a PEPM. So if you have 50 employees, you're paying, the pricing per month or per employee per month, 50, eligible employees.
Right.
Or if it's 500, you're paying 500 or 5,000. So it's scalable and adaptable. What I found in working with Will is the flexibility. So I've had clients ask for a lot of things that I was like, oh, now I have to talk to Will about this. And he's like, yeah, sure, we can do that. So that's what I really think is unique about what he said before about not taking investors and really being able to make that decision in-house and using some of the things that you've gained from other employers. You've improved your content and your platform that helps employers down the road.
That's correct. And back to that point of who we are as a company for our clients, being independent allows us to see 2 years down the road and build for that, 5 years down the road and build for that, 10 years, whatever that is, and not be solely driven by the next quarter's EBITDA, because we're not. What that means is that oftentimes we'll work with a partner, and with that partner, they'll say, what would be great is if we had this thing that would be great for our folks. And then we build it. And we don't charge them because it's going to be good for us. It's good for the relationship. It's going to be good for other relationships. We build it because that's who we are as a partner.
So let's talk about that part a little bit with some of the flip books that you've built out. That came from a request, which we've worked together on the Employers Healthcare Alliance digital resource library. And one of the clients that I was working with said, wow, that's really cool. And then that client subsequently said to Will, hey, can you put this in the flip book form? Can you show us those 3 flip books? Because I think that will show the magnitude, your flexibility, but also the magnitude of your programs. There's one for webinars and education. There's one for incentive management. There's one for challenges. So pick and choose whichever one you want to show. And let's just show that a little bit, demonstrate that, so that folks can see exactly the magnitude of the programs that you offer. And then we'll dive into the platform, the dashboard, and the like. Does that sound good, Will?
Okay, so which am I showing first?
Let's do the webinars.
Okay. You mean the with the flip book?
Yes.
Okay. Let me show you my screen. Share my screen. Da-da-da-da. Share.
There you go.
Okay.
Perfect.
Can you see me?
Yes.
Yep. This is engagement that moves the needle. And so what we did was we created this where you can download a portable copy, you can flip through, and this is such a nice portable structure that it allows us to get this to our groups. And we have an organizational partner that has individual clients, companies, like you're saying, Bob, like here's a 150 life group, here's a 1,000 life group, all over the map. But because this is portable, you can get this to any of them at any time. Make sense? And we have one of these for our incentive management system for our programs across the board.
And these are all webinars that are self-guided. So you jump on your dashboard and you choose a webinar, or your health coach might say, hey, Kay, I know you want to lose weight. Here's a really good webinar. Or the push notification might say, let me direct you to this weight loss webinar. So it's all self-guided.
Right, right. So let me talk a little bit now about the, this is our user platform. This is the user-facing space for them. And one thing I want to start with is by saying that all of these parts and pieces are things that you can pull in or pull out. We've built it to be so flexible. So there are groups who will just have this is the dashboard. Maybe they just have challenges. They just have the care alerts and notifications. Cafe Well, the communications pieces and the blog articles and newsletter. You can have you have the flexibility to build the program you want. And I know it can live like it's a lot for folks, but that's where we come in and we help walk you through that. And yes, Kay, when we do an HRA, we can use ours, or we can import another group. So we have that flexibility as well. So I just want to show you, when you're done with the HRA and you want to finalize it, then you're immediately taken to your results page so you can see exactly what to do and how to do it. And then you can also see that the system builds your journey. For this particular one, showed that this person was diabetic. What are the prevention programs? How do you understand food labels? Because this is what they said they wanted. And that is where these came from. It's immediately tied to your incentive points, so you can incent people to complete them, and it's tracked. And that also is routed back to the nurses station, which is.
And we'll stop for one moment. Hold on this page.
Yes.
So you talk about incentive points, and up here you see 255 Mojo points. Those are your incentive points, correct?
Correct.
And then scroll down just a little bit, because I want to point this out. Scroll down a little bit more. Right there. You can opt in or you don't opt in. So you get that information based on if you opt in or you don't want to opt in.
That's right. Exactly.
So I won't be getting all of those nasty emails and text and everything if I really don't want them.
That's right. That's right. So for our clinics, we can, I think this is our clinics. Yep. So we can get care alerts through our analytic feeds that we get from claims data. And this allows us to remind folks to close their care gaps. And we can put in, if you have a clinic, then we can put in the scheduler to schedule the appointment for that particular clinic. So that, I mean, so, and this is personalized. This is for each person. So when they are ready, they can schedule that appointment with their physician, and we can make that an incentive point driven thing too, so that if you schedule with your physician, then you can get your points to get your reward, whatever that is.
And you drive the rewards too, right? So the incentive points, let's say a customer has an incentive of annual wellness exams and biometrics. They complete that. You can send a list to HR of all of the people every month that have completed that will get their rewards, and you can also help guide that process through. So again, it takes less pressure and less work on the HR team.
Yep, exactly. And we can automate that, much of that, so that it does take the admin overhead off of their HR team, because no HR director wants to have a 17th job. It just piles up, and it's not fair, and it makes you inefficient. Not your fault. But so what I'm showing you now is the clinical backend. So I want to say that in our program, we interlace the clinical aspect, health coaching, disease management, large case management, all those things. We interface that with the well-being side, because the well-being side and the clinical side typically are in their own silos. And that's why we built this. This is caregiver facing, where you type in the person's name, you go there, and at a glance, you see their biometric data, you see their behavioral data. You can, if you get an updated value, you can add it. You can look at their history. This is so complete.
So this is the MedWell portion of it, and then you partner with Intervent, which will be next week's webinar.
Yep.
Who actually does the coaching and disease prevention and management. But this is the platform that puts it all together and delivers that information to the coaches and the preventive and disease prevention and management team.
Exactly. And the nice thing about this is oftentimes if you're a coach, you're talking to somebody and they'll say, oh my gosh, I got my new Skechers. I love these. I want to walk. And the health coach can say, well, you should do that. Talk to you next month. Whereas here, you can say, oh, cool. Let me set some programs for you. And so you can say, let's get you to a walking program, and we can assign that for you so that you can have your activity tracker. It tracks your wearables, all of them, and you can set your goal, set it over time. And when you do that, you can see it. The person, the coach, can see how you did over time. So the next time they come in, there's a little bit of accountability. Instead of the person coming in and the health coach says, so how'd that walking go? And then they're like, I don't know, not as good as I'd like. This way, you've got some follow through, and that really bumps up the engagement and the outcomes.
So, Will, I was just going to ask that, this is more the employer or employee view, but what about employers that struggle with low wellness participation? How does MedWell help increase engagement?
Let me stop sharing just for a minute. We do that through our communications. And hold on.
You get all choked up talking about this, don't you?
I do. And so low participation, it can be an employee problem, but it's more likely a design problem, right? I mean, programs oftentimes they fail to understand human psychology. They offer one door, one motivation type, one starting point, and then they blame the workforce for not walking through all that same door together. Strong engagement needs a range of motivational pathways, competition, community, convenience. There's several things. So every motivation type, we provide a lot of motivation types, each for its own entry point. That's why we emphasize personalization in what every member sees, making sure it's actually relevant to them, right? So there's team structures and corporate campaigns and social connection between people in our peer-to-peer network. Also, there's communication rhythm, like we've been talking about. Engagement cannot be just a launch event. You have to think like a marketer and be smart about it. It's got to be an intelligent campaign that accommodates people who want to be on text or not, want to have more notifications or not. And that's what our system does. And here's what makes it accountable rather than just active. We work hand in hand with well-being committees. We report on participation, engagement, and outcomes. So we're not, just guessing whether it's working. We're showing you. And because we can correlate an individual's wellness activity with their own behavioral and clinical outcomes, we can understand the DNA of the employer group too, because they have their own pattern. What motivates this workforce specifically, and customize that program over time to fit it better. That is a living program. That is dynamically aware.
So
it sounds
like you're also really involved in strategic planning, 1, 3, 5 years, and looking at the outcomes to give recommendations and guidance. So the HR director is not out there on a limb. So talk to us a little bit about a small to mid-size company and what's the lift for the HR person, the HR director, HR professional, if you want to integrate MedWell. What do they need to do?
I'm going to say they need to start small and specific. You don't have to launch everything at once. I mean, the pattern that works, pick one company-wide challenge to create that initial energy. And, something simple, team-based with a defined start and end date, make it easy because we can plug any of that in. Then you can layer in a monthly rhythm, a webinar, a cooking demo. So the program stays visible, but you don't want it to demand attention every day. And critically, for a lean HR team, like with the one we're talking about, we do carry that operational load. The communication plan, the campaign calendar, the platform administration, that's on us. That's not your HR person's job. So then we build from what the data tells us. We look at the activity. If the challenge lit up, but nutrition set quiet, that informs your choices. Crawl, walk, run. Let the participation data inform your path.
So in that mode, let's say I'm a company of 50 employees. I'm very interested in what you're saying today. I want to get involved with MedWell, and I'll reach out to Kay to start that conversation. I'll leave my information at the end of this meeting, so anyone that's interested in reaching out, please reach out to me, and then we'll facilitate that conversation. But from the time that I say, yeah, let's go, what does go mean? How do you implement MedWell? You talk about the crawl, walk, run, but let's implement the crawl. What does that mean? How do I get the word out? What do I need to do as an HR professional, or what does MedWell do so I don't have to do it to launch this?
For us to do what we do well, it starts with a conversation, not a contract. Contract happens. We need to understand your workforce, your culture, what you've tried before, and what your actually trying to accomplish, right? Big picture. You want broad engagement? Do you want risk reduction, support around an existing clinic, or a blend of those? Because that informs our choices around the design. From there, you can design the starting configuration. We'll do that together. What programs, what challenges on the calendar, and what does your branded calendar look, your portal look like? Because we can white label it as yours. If you are a broker group, we can white label it as yours for your clients and give you your own URL, all those things. But we need to have that conversation up front. And so one discipline that I encourage every employer to hold any vendor to, including us, agree up front on what success looks like. This is what we'll do, Kay. And agree on what does success look like and how do you measure it? Such a data head. So define the metric before you launch, not after, because that single habit separates the programs that eventually prove their value from the ones who just, review on inertia. After all that, we stand up the portal, we launch that campaign, off we go, and then we look at the data as it comes in together. It's that living program that's dynamically aware. That's sort of the next steps from here to launch.
And if employees have questions, do they just show up at HR? Do they contact HR, or do you front load those questions?
We can do it either way, and we have done it either way. There are large organizations that we work with lots of companies, little companies, and they want to own that relationship. So they will field all of the customer service calls. That's fine. And then they'll aggregate those and get those to us. Fine. Alternatively, if you don't have that person on the payroll, then you can just let us handle that, and we'll triage those and do that legwork for you.
So we've covered quite a bit of ground, and you've given us a little demo. We'll get into the closing and Q&A. Let me just open it up for questions, and I see that Bob has a question. Bob, what is your question for Will?
So, Will, I don't know if you've heard of this thing that employers are dealing with called GLP-1s. That was a joke, not a good one, but
Yeah.
I laugh.
addressing that specifically because it is a number one hot topic right now. Addressing that specifically, how does MedWell help provide solutions, support the GLP-1 issue that employers and their work families are facing?
Right. So we're your off ramp. So the problem, to restate the problem, this is a medication that's effective while you're on it. And the numbers for recidivism, the numbers for staying on it are awful. And while you're on it, the impact is strong. And that's why people keep getting on it. But if you haven't changed behavioral habits, then if you haven't changed those habits, the thing that got you there in the first place, when you get off the medication, and like, I forgot what the numbers are, they're crazy. It's like 67% are off after 24 months. Then typically much or all of that comes back. All the problems that you had before, it comes back again because you didn't learn the behavioral habits. So what we do to support that is we can provide, how do you learn the healthy eating behaviors? God, that's our sweet spot. How do you learn those so that you can apply those in your daily life, so that as you wean off the meds, you are still, you're adopting these habits. And there's a time frame when that's sort of optimal for you to do as you start coming off, to really reinforce those behaviors. And you have to learn them. And once you learn them and you make it a part of your life, then it's expressed through your behaviors. It's who you are now, so that when you eventually get off those meds, then you have the tools you need to be less likely to slide back in and need the meds again. Golly, I mean, it gets me going. You push the button, Bob, because people need this so much.
I can
But
tell there's a little passion in your voice, right?
right, right. I mean, they need it so much. But if you're a payer, insurance or self-funded, whatever, you want to help your people. You're here to help your people. But if they're spending $1,500 a month over 24 months, and then all of that goes away, then you've just lost all that cash. You haven't done anything, and it's cost you a mint. There's got to be an off ramp. There's got to be this transition to behavioral wellness. And that I said, as I said before, that's kind of that's home base for us. That's where we live.
What's great about that question as we kind of wrap up and give some really key components, key takeaways, is what you just said, both of you, with GLP-1 is the integration with MedWell and Intervent as well. So MedWell is the behavioral health, the behavior modification, the nutrition changes, the becoming active, and Intervent, which is coming up next week, is the health coaching, the chronic condition prevention and management, that when people get on GLP-1, they have that clinical overview, right? That clinical guidance. And then it's also integrating the wellness component with MedWell. So it comes together really nice. That was a perfect segue. So, Will, thanks for that overview of MedWell and kind of a segue into Intervent next week. But, you know, what I really appreciate about MedWell is the approach of connecting all of the priorities for both the employer and the employee. I mean, they can do it individually. They can do it as a team challenge. You can integrate the incentive mojo points for annual physicals and biometrics or whatever it may be. You get the fun component, not fun, not done, with 57 plus challenges. But you also have the personal approach where, hey, if I just want to go on and learn more about eating on my GLP-1 diet or eating on my GLP-1 medication, I can go in and do a webinar. I can do education. And it's all brought in an individualized, customized. If I want it, it's there. If I don't want it, I'm not going to get bothered. So, you know, the platform is really very employer and employee friendly. And that's what I love about it, is it's very flexible. So, Will, any last words that you'd like to bring about before we close out today's session?
It's pretty comprehensive, Kay. I do want to echo what you said about Intervent. They are an exceptional organization that I am very impressed with, and we make a good team together as the healthiest lifestyle on earth, and one of, to be honest, the best chronic disease management health coaching platforms that there is, with the predictive analytics that is the most accurate in the country. It's kind of like best of the best of the best.
Yeah, it truly is. I mean, all three of you are award-winning and have been in existence for 25
Right.
plus years. So
Yep.
that's a really nice segue, Will. Thank you so much. Next week, we have Intervent Health, which is the continuum of MedWell and wellness, predictive analytics to, okay, now you have this, now what? How do you coach people? How do you get into disease prevention and management? And as Will said, Dr. Neil Gordon has been heavily involved in this for over 25, 30 years. They do a lot of publications and they have award-winning programs, just as MedWell does. You can also access this webinar by reaching out to me. I can send you the webinar YouTube channel at Bob McCollins. And we also have, remember, the digital resource library, you know, kind of that flip book that Will showed is also a digital resource library that we put together specifically for you, for the Employers Healthcare Alliance. It's a vetted, it's a vetted resource that if you're looking for something like MedWell, hey, I want to do a wellness program. Who do I reach out to? Do I have to Google search? Do I do AI? How do I find these vendors? Well, we've put that together for you. We've vetted the vendor solution partners. We want to make sure that they really care about the employer and the employee, and it's not just how many people we can get in and out the door. And that's why we chose to partner with Will. As you heard today, that's kind of his DNA. As Bob would say, people like us, right? We're really interested
Right.
in helping you get the best resources available. That's the digital resource library. All of that can be found on the EHA website too. So we'll end today's conversation, and thank you all for joining. We appreciated all of the time and effort that you all put into joining today. Again, reach out to me if you have any questions or if you'd like to get a hold of Will. Happy to help with that. And we'll see you next week at 2 o'clock for Intervent Health. So thank you all for joining. Hope you have a good day and a good
Thank
week.
you.
Thanks, Will.
Take care.
Bye-bye.